Our professor.
Sisters Wado. This is a woman's topic. As you will all know, it is all about menopause. And it's titled, All We Need to Know About Menopause. Sometimes we ask ourselves, I don't reach that stage. I never reach. When be that stage? How is it? Some of us are asking ourselves, what thing I could do? What thing I not could do? These are all the things that we will need to know. And I am going to hand this microphone to my beloved sister. Somebody will be asking, now this Sister Salome will talk. Sister Salome is a specialist senior nurse in women's health, where everybody gets a specialty inside this work. Even inside the house of God, we get our specialties. Yes, I may be qualified, I know where my limitations are. So I had to bring in Sister Salome to talk about menopause, based on the fact that this is her area of specialty. So, without mincing words, Sister Salome, nice strong for this side past me. So by the grace of God, the little when I know, I will talk about, but the much she knows, she will be here to talk about it. So I'll hand the microphone over to Sister Salome. Thank you. Sisters Wado. First of all, I give thanks to the higher powers for enabling us to gather here this afternoon. And my thanks goes to the Women Fellowship Committee for giving me the opportunity to talk about menopause. Thank you, Sister Ebi, for that wholesome introduction. Yes, I used to be a women's health practitioner, but that was 10 years ago. But some of the knowledge is still there, so I will share what I know. And afterwards, so I'm just going to make it very short, as the title of the topic goes, what all women should know about menopause. So it's bite-sized, it's just going to be headlines for us to bear in mind. Yeah? Okay. It's a natural milestone in a woman's life, and a woman is said to be in menopause when their periods have stopped for 12 consecutive months. It has to be 12 consecutive months that you do not have menstrual period. That's when it can be said that a woman has gone through the menopause. Before I talk more about menopause, there are other conditions that are linked to menopause. I will touch briefly on those. Perimenopause. Perimenopause is the period just before menopause. And the age range that can occur, it can be anytime from 45 onwards. How do you know you're in perimenopause? The common signs is that you may experience what is called menopausal symptoms, which most of us here know, especially if you're in my age group, that is hot flushes. So you may get that, but before you even start getting that, you will have irregular periods. That means maybe in a month, you may have menstrual period twice or more, or you may have periods 1 month, and then 2 months you don't have a period, and then the 4th month you have a period. So that's what we call irregular periods, and then hot flushes. So that's perimenopause. In order to be sure that a woman is in perimenopause, because there are other gynecology conditions, that is the other women's health conditions, that the symptoms are also irregular periods. The symptoms can also be mild hot flushes, things like endometriosis, that is when the lining of the womb is outside the womb, things like adenomyosis. Sometimes lesion at the neck of the womb can also cause irregular periods. So if a woman is experiencing those irregular periods that I've described, it is important that you see your GP, because then perimenopause can be diagnosed, can be confirmed by hormone test. Yeah? So the hormones are estrogen and progesterone. Yeah? So that's what the ovary produce that instigates menarche. That's when young girls start seeing their periods. So it is important. I cannot emphasize that enough. So don't take away that, oh, I'm bleeding irregularly. I'm bleeding 2 or 3 times a month, or I've bled once and maybe it's perimenopause. No, it is important for you to check so that it is confirmed by blood test. Yeah? And then there is early menopause. That is when a woman stops seeing their periods before menopausal age. And that is any time before the age of 45. Again, early menopause is confirmed after a woman has stopped seeing their periods for 12 consecutive months. Leading up to early menopause, just like as in perimenopause that can start anytime from age 45, anytime before the age 45, if a woman starts having irregular periods, like I've just described, it could be signs of early menopause. Yeah? So, the 2 important bits is menopause and early menopause, because menopause is a natural event, right? Even though, so menopause can occur anytime from the age of 45 onwards, but the average age is at the age of 51. It's individualistic in the sense that you can be up to 56 and you're still seeing your periods. There's nothing abnormal about that. It's just how we are our genetic formation. Yeah? So, what are the signs of menopause? So, there is hot flushes I've talked about. There is what we call vaginal atrophy. So, how would you know? So, atrophy just means when something gets thinner. So, how do you know you have vaginal atrophy? You may have dryness. Coitus might become, there might be discomfort and maybe painful. Yeah, so those are the 3 main symptoms. Symptoms that are uncommon, although it can be associated with menopause, is feeling dizzy and your heart beating really, really fast. Those are all signs of menopause. And like I said, menopause is a natural milestone for a woman. So it doesn't necessarily mean that you have to take medication to treat it, even though GPs push it. So I will talk about the reasons why. That should not be the first port of call, because there are other things that we can do to help ourselves. So, for example, the hot flushes, just simply wearing layers of clothes, that's easy. So, because with hot flushes, you can also get, as soon as you get hot flushes, that's feeling hot, feeling really sweaty, and it can come suddenly. The opposite can also be the case, where you get really, really cold as well. So, wearing layers of clothes mean that if you're cold, you wear your layers on. If you're hot, you take them off. When the hot flushes are really bad, just running your wrist under cold water gives immediate relieving effect, because there are blood vessels that are very close to the skin, and once those blood vessels are cool, the coolness transfers throughout the system. Other things that can help hot flushes is regular exercise. So this exercise should not start when you're perimenopausal or when you're already menopausal. It should be part of our lifestyle that we exercise, because what it does is the exercise conditions our body that our circulation is at optimal level. And if our circulation is in optimal level, that means our blood vessels are able to get oxygen easily, which will help generally. So exercise is fundamental. Another reason why exercise is fundamental, After menopause, women, depending on how fit they are, they might get what we call osteoporosis of the bone, that's thinning of the bone. So before you get to menopause, if you're doing exercises, the hormone estrogen, why osteoporosis is common in menopause is that the hormone estrogen is needed for the calcium that is in our food, in our blood, to get absorbed into the bones. And doing exercise, so pre-menopause, when you're doing exercise and this absorption is taking place, doing exercise, that's high impact exercise, it strengthens the bone. So after menopause, it will take many, many years if your bones are strengthened already for you to get to that stage where it will be thin. Yeah? So what else? So as women, thank you. So as women, main part of us, why we are women, is ability to have children. And a sign that a woman can have children is having periods. So when the period stops, some women can mourn as if they've lost something. It's natural, and you can just find yourself in tears for no reason. So again, going back to exercise, doing exercise makes your blood have a lot of endorphins, and endorphins will counteract that part of it. So eating foods that contains natural estrogen also helps. So things like soya, I don't know if you guys know, tofu helps. Flax seeds, so these are seeds you can get from health shop, just put them in porridge or in cereal, helps. Our yam also help, but it's not advised to take it a lot because then you gain weight. Also trying to lose weight as well helps with the hot flushes, helps with strengthening of the bones, and less alcohol intake. And of course, I will assume that a lot of us smoke. Yeah, and smoking also helps. Yeah. Then moving on, what for us? Once your periods have stopped consecutively after 12 months, if you have a bleeding, it's called post-menopausal bleeding, and it is important that you get it checked because it could be a sign of that the inner lining of the womb is getting thick, and that's a precursor to cancer of the womb. So any form of bleeding after 12 months of the period stopping, you must see a doctor so that that's investigated. Yeah. What about HRT? So I have talked about things that we can do naturally because menopause is a natural, so we can handle it naturally. However, if the symptoms, your hot flushes, your tiredness, palpitations, if it's that bad that is affecting your day-to-day living, you cannot do things, naturally, it's affecting your work, then it's time for you to see the GP for hormone replacement therapy, and it's basically replacing the estrogen and progesterone that your ovaries have stopped producing. So how long do you use the HRT for? As when I was practicing, just because they are associated risk with long-term use of HRT, because HRT is a medication that we can get dependent on. So it's called tolerance. So when you take it, after some time, the dose you've been taking, where it's been relieving your symptoms before, it stops. So it needs to be increased, going to stronger formulation, and it can go on and on. And any medicine you take has to be processed in the body, and there are side effects. So women is that they should take HRT for some time, maybe for 1 year, 2 years, stop gradually and see how their body is. not to just to continue taking it. Another aspect I forgot with symptoms of menopause is feeling tired. So that's a big part of it, and that aspect, apart from estrogen and progesterone that our ovaries also produce testosterone. That's what gives us energy. So obviously that will be low, so we'll get fatigued. And something just flew off my head. I was going to say something. Right. So again, exercise. Even though you're tired, you'll be thinking, how do I exercise? But once you start exercising, the first week you'll be tired. After the first week, so long as you do it regularly, you become energetic. Yeah? So that's why exercise is important. I remember that symptom of menopause is also lacking the, I don't know how to say, if you have young people here, lacking libido. You guys know what libido is?
Yeah.
Reduced libido.
You drive.
Yeah, that's why I said reduced, libido. Yeah? So if it's becoming problematic, testosterone replacement helps. Yeah, but try other weighing stuff before you go to testosterone. Yeah. So that if you're having symptoms, most GPs that are not trained in that do not have specialist training in menopause, they might advise you to take HRT. I would do that with caution, unless it's absolutely necessary, because there are side effects that are attached to it. Yeah. And but for any menopause, HRT is necessary because your body hasn't reached where you should stop menopause naturally. So all the benefits of estrogen and progesterone, your body hasn't accumulated it, i.e., your bone mass. So you need it. Yeah. I think that is all.
Good. Thank you. Thank you.
Sisters Wado. I thought I should add some too that I know about. And one of these is about our psychological health. We have a lot of mood swing, low mood. One day, one person is excited, the other days they're just down. It's all the menopause. And how do we go about it? Sister Adaze's talk today about mindfulness is another way that can help us. When you find out that this minute you're so erratic, I don't want to anything, you're all over the place, you just calm down, look at yourself again, tell yourself, what's going on? Sister Salome also talked about decreased libido. Decreased libido, we know how it could affect even the men. Just to let all of us know, men also have male menopause. So when it happens, they too, they're just not interested. They just look at you, not wanting. Everybody is just fighting and trying for each other. But it's that time that we should look at ourselves and give ourselves a bit of space, rethink, come back, and then fire on again. If you find out that there are areas where you are struggling, please don't struggle alone. Seek help. Thank God we're in this society. There are specialists that can help you. If you come into this service of God like this and you have specialists like us, there are many more of us here, you could ask questions and they would be able to point you in the right direction. If we don't know, we will point you in the right direction. Even with vaginal dryness, there are things that you could use. Again, seek help. Don't suffer alone. Don't keep quiet to say, I dey shame more. This shame matter, you know they help. You go shame until before you know what I don't pass direct. So we should seek help. I don't know if anybody does it. Thank you, sisters.
Thank you.
My question is this. A lot of people struggle with menopausal weight gain. Is it manageable at all in any sense? Or would you just advise to just let it be? Maybe it will maybe come down later. I just want you to elaborate on that quickly, please. Thank you.
Thank you, Sister Daze. With regards to weight gain, we all know that our lifestyle matters a lot. And as we get to that menopausal stage or period, our activities are also reduced. Sister Salome also talked about it. Lifestyle changes is important. If you were used to not exercising, it's important to start exercising. If you're used to eating 5 bowls of pounded yam, please reduce, because even the metabolism, the rate at which you digest and process all the things we eat is a lot slower. So you will need to have a complete lifestyle change. So if you're going to be eating 5 pounded yam balls, please reduce it gradually and eat healthy. Eat frequent small meals will be better than one big meal. So all these are things that we need to consider with regards to weight gain. And knowing this, let us not wait until the menopause when everything drags us down. Let us start now, if anybody hasn't reached that stage, to continue to build themselves up, hoping and knowing that menopause is coming. Thank you, sisters.
Thank you.
Hold on.
And just, yeah.
So with regard to menopausal weight gain, the weight, so you might be exercising, your diet might be good, but you might find that you have a purge, yeah? That is postmenopausal. Apart from tummy talk, really, there's nothing you can do. But so long as your weight around your waistline, so as Africans, our build is different to that of Caucasians, except some of us that are lucky, that are really skinny. So no matter what your weight is or your tummy, so long as the way you can gauge if you put on what's the word now? Unhealthy weight is if you've lost your waistline around the corner. So that's where you have to look out for you, because there are many risks. If you have weight there and there, your risk of getting type 2 diabetes increases to the sky. So yeah, so those are the things. So you might not be skinny. What I'm trying to say is, you might, to target that you're going to be skinny, like our young ones, that would be over being ambitious of your target. But if you put a target that is reasonable, it will encourage you, and then just look at your waistline to the side. The question is, does birth control, example IUD, affect menopause? No, it doesn't. IUD doesn't affect menopause, but there is a different type of, we don't call it IUD because IUD is just copper, and then there is what we call intrauterine system. So that's the one we used to use when I was practicing. It's called Mirena. The Mirena helps. It helps. Yeah. So yeah. Yeah. So the Mirena helps. Yeah, the Mirena helps. But the IUD doesn't. Yeah. Correct. Okay. And then now that we're talking about Mirena, the IUS, Mirena, also, if you have it in situ, it also helps with the vaginal atrophy and the dryness. And if vaginal dryness is a problem, especially intercourse, there is something you can get off the counter. It's called Vagisil. But you need to use it regularly, maybe twice a week, continuously, and that will make the lining of the vagina lubricated. Supple and lubricated.
Okay.
It's not new. About that, nobody's it's above learning. It's about having trust. Our girls, many women survived. So I thought you should educate them on it. It causes by uncleanness, because that trash, if you are not careful, if you don't look after it, it's very bad. You know? So I think we should educate us on that as well. To our young girls, our children who are period, who are in where who do have trash.
Thank you, ma'am. One question here, please. Did you want us to take this?
Answer mommy first. Answer mommy now.
You had a question, didn't you?
Yeah, go ahead. We take her together.
Okay, okay. Yours is more related to what we have talked about, I guess.
Like this menopause, some people suffer it when they are not up to even 40. Some people, because with what the world is going, this their so-called family planning, destroying, don't know whether it's the womb or something else. Because when they will go to the clinic or hospital, they will say, for past 1 year plus, I've not been seeing my child. When you ask them the age, it tells you 36, 35, even some 40. They will ask, what are you taking? And I'm doing family planning with the injections, 3 months or 2 months. Or some tells you they take daily pills. Some will tells you they fix coil or they use the one in the hand different. So with what the question is now, with all this really cause menopause at early stage
Thank you.
in woman.
So it depends on the type of oral contraceptive. Contraceptive that are progesterone only, that's how they are made to work. That while you're on it, so long as you're taking it how you should take it, you don't get any periods. And most of the long-acting oral, most of the long-acting injectable contraceptive, like the Depo-Provera or Implanon, they are all long-acting progesterone-based medication. So once your body as a woman, so if we go back to menstrual cycle, so as the first 15 days of the month, our ovaries, so when we are still saying period, our ovaries produce a lot of progesterone. And then when the level of progesterone drops, that's when estrogen, no, first 14 days of the month, progesterone and estrogen is being produced simultaneously. Then, after the 15th day, the level of progesterone drops really quickly. And that's when, because there is no balance between progesterone and estrogen, that's when the lining that has built in our womb, that's when it sheds as messes. So that's what the progesterone only contraception mimics. So long as the body gets estrogen continuously, that means there will be no lining of the womb to shed. Yeah? So where it can lead to early menopause is that if it's taken for a very long period of time, our body is what it is. It's what you teach it, that is what it gets used to. So if you've taken it for a very long, so I'm talking about years, 5 years, 10 years, you might stop it and you don't get any periods for 12 months. So for a very long time, it can cause. Again, I don't know if things have changed. When I was practicing, especially for me, when I see young girls, progesterone only it's very convenient because you don't get periods, so you can do anything you want. There is no that, oh, am I going to be sitting and I'm going to get period, or do I want to go and swim and then I'm on period? So it's quite convenient. So when I see young stars, actually the ones that have not had any children, I tell them, use it for some time, have a break, use something else, and then you can restart again, so that the body doesn't get used to not. The ovaries doesn't get used to think that they've been retired.
Question. Thank you for that talk. An observation and a question. I think there was a symptom I felt you didn't talk about, which I learned not too long ago, and it's the correlation between menopause and memory loss. And I think they call it brain fog. Yes. I didn't know about it.
You are right. Yeah.
That feeling where you may just forget somebody's name, or you're at work, your boss gives you an instruction you can't even remember, or like me, every time I go to my car, I forget my keys. I have to go back. How do you prevent? How do you reduce brain fog during menopause? And is there a timeline at all where the brain fog reduces, and this is an ongoing thing?
Thanks for that observation. Brain fog, to be honest, for me, what I have observed is continually training your brain. There are lots and lots of things we should do. Even if it's the games that we play, just continue to keep your brain active. Engage your brain. Don't say, I don't understand. And the more you don't do it, the more the brain gets used to being lazy to do anything. So if you decide that this morning it's just even before getting to the menopausal period, if you know how to plait hair well, you plait 1 day, 2 days, you get better at it. So the same thing happens to the brain. So with regards to it getting better, it is based on what you feed your brain, the activities you give to your brain to make it work extra, that will make the function carry on.
Last question.
So to answer your question specifically,
Yes.
Sister Oyewo, so memory loss, forgetfulness that is associated with menopause. For the short time, depends on individuals. It's just like how you get hot flushes, the menopausal symptoms. Some women might experience it intensely for 6 months to 1 year, and it goes back to normal. It's the same with memory loss. So it could be that during that initial time, because your whole body is trying to refigure how the physiology works. So it could be for 6 to 1 year, and then your brain reverts back to normal. But as we get older anyway, due to age, it's age related that we forget things anyway. So menopause is different, and then there is age on top of it. So what I'm saying is that with menopause, it can bounce back, but then there is the age factor that may make forgetfulness going on. And like Sister Ebi is saying, crosswords, crosswords help, and then easy mathematical calculations. Yeah. So not any form of games, specifically crosswords and plus and minuses.
Those of us who can't do mathematics and crossword.
Psychotherapy helps as well for brain fog.
Mathematics and crossword, which other thing? Because some of us, we don't do mathematics. So.
Manage this is around making sure your room is suitable, it's warm enough, it's not too hot, it's not too cold for your body. So that when you get into bed, even the bed, you can feel really good. Just cutting sheets and try and eliminate anything that you think when I eat this food for evening, it doesn't make me feel good. There are lots of things that will do. So it's treating symptomatically and understanding yourself. If I eat puff at night, I will keep my eyes on, cut it out. If I drink alcohol, it makes it worse for me, cut it out. If I sleep on this hard pillow, it makes it cut it out. So it's treating symptomatically. Thank you, sister. Sister Lab.
There's a question here that says, what food helps with menopause?
So
yam. Yam has a lot of estrogen content, but then there is that flip side that it will make you gain weight. So soya-rich food helps. So there are lots of researches, one of them being mine, that shows that actually if you eat so much quantity of soya in your diet, it's as effective as taking HRT. Tofu as well. Flax seeds also help. Thank you.
Thank you. Okay. So a question there.
I just wanted to add to Sister Yewo, what she was talking about brain fog for menopause. I was also thinking that just like the ways of technology will help us to remind ourselves about certain things that we usually forget. Maybe having a daily planner, and maybe when you're in the office, you have your little jotter and your pen to just jot down things, and you can refer back to it later if for any reason you can't remember what to do. I mean, that might also help to bounce back to you.
Thank you.
So what if as we get to the car, we forget the key? What will help us with that one?
Put an alarm. Put a reminder on your phone. Put a reminder on your phone.
Okay, reminder on the phone, get your car key.
Yes.
Okay.
If I show you my phone,
There's a lot of reminders.
there are lots of reminders, recurring reminders, how I should even pick this before getting out. At least maybe 5-10 minutes before I get out of the phone. So
Okay. I just want to get it clear, yeah?
health strategies.
Yeah. Okay, what about as we walk into the kitchen, yeah? You say, what you carry me call this place just now? Yes, so what you carry me call this place just now?
The brain fog will differ person to person.
Okay.
And as we are making light of it, there are some people that are almost like dementia.
Yes,
from the menopause stage. So
yes.
this is how you manage it.
Because
it's the fact that you go out, you seek for help as soon as possible. You discuss it with your colleagues, people you know will give you help. And then the NHS website is there. It's got a lot of information and help as well. There are societies on menopause as well that you can reach out to. Don't feel shy if you're here, but there is help for menopause, and it is quite serious for the symptoms.
yeah, and that's Sister Rume, also a medical practitioner.
They are pushing us to.
No, it's my stuff. Mama, na this thing.
This one would be a very funny question, but I just want to find out two questions I want to ask. One of them is that I know we've been talking about weight gain. With the menopause, do we lose weight as well? And how can it help? Because there are some women, there are some women who don't even have interest in intercourse anymore. They don't even want their husband to touch them. It's like don't even come close to me. So it's like a separate place in between that bed. Just like you said that the men they also so how can they help them with that situation as well? Yeah.
So with menopause, because of the physiological changes, women will gain weight. If they used to be size 6, they might go to size 7 or size 8. Yeah? If they want to try and lose the weight, it has to be diet and exercise. Diet and exercise. No, not diet, eating healthy and exercise. Yeah? So in terms of not having libido, yeah? So there are two aspects of it. It could be because of the discomfort that is associated with coitus. And if it is that, what we discussed about the IUS, not IUD, IUS, so intrauterine system that has hormone on it helps, but that's later stage. So things you can get over the counter, like I said before, Vagisil, that's the most common one. So it's sort of like cream, you spot it in. Yeah. So ordinary lubricant can be messy and they just come out. So they will help that minute, but it doesn't make the vagina long stay supple. But like Vagisil that I talk about, there are other ones that are there, but with the Vagisil, it does over time actually rebuild the lining of the vagina. Yeah? And if you go to the chemist or even on the internet, there are several sort of cream pastries for postmenopausal women. Be careful, read it. Stay away from the one that has anything that is called estradiol or estrogen, because that's what we do. What that would do would abnormally build the lining of the vagina, and that has effects. If libido is really, really low, then you need testosterone implants. Yeah? And for that, you have to get through the NHS. It's prescription only, like HRT. You need testosterone.
Thank you for this. She provided all the answers that is needed. Sister Salome have also brought up some questions as well. Another thing I needed to just add to it is having conversations. Conversations with our husbands about, it's when you have this conversation about what I'll call it M, to build more understanding about how you feel and what is going on with you, it does help.
So not questions, but I think just confirm with what we have said. I think from Sister Lucky, reading helps too. Also, she said there's medication that you can get from the GP to increase or reduce your libido. And Sister Obi also mentioned that there are supplements from Buran and Barrett that's not tablets that also help with the symptoms as well. Oh, and Connie.
Thank you.
Everyone that has contributed so far. Yes, I think a lot was said about sharing and also talking. Another thing that you forgot is the thinness of our hair. Some of us don't lose all our hair.
Yes.
I used to have a full hair of hair, these people. Now, my hair is so thin, and I put it down to that also. It's part of what they say can cause it. But what I want to share with you is also about talking. Quite a few months ago, it's probably going to 3 years now, as I just recently moved and Maria is my neighbor. I was suffering so bad with the hot flashes and everything that comes with it. So I went off to my GP and they prescribed HRT. And on my way to pick it up, I went to see Maria. And while we were talking, sharing, I said, Maria, this is what they've given me. I'm suffering. She said, Auntie, don't take it. Auntie, I beg. I said, I know all about the side effect, but it is just too much. I'm losing the brain fog, it was bad. I couldn't even remember anything. Things that I was supposed to do at work, I would sit down there all the time. I would go to one system, what was I doing? I'm flipping from one system to another, and it was just getting too much. And I thought about it and I said, I'm not going to take it. The way Maria pleaded, I got home and I set it aside. And then I discovered a collagen, which is a natural, is a fish, it's made from fish oil and fish whatever. It's called collagen, natural collagens, and they have been so helpful. So it has helped, but you have to take it for a very long time. So, and it has been really good. I can say for me, it has worked for me, and I just wanted to share that. So it's good to share.
Thank you. Understand that there are differences between age-related issues and menopause. Hair loss is possible, but it's not what has been put there in our books. Some of our books, it is.
It is, yes.
It's about 34 symptoms of menopause. Yes. And we should also understand that we cannot stay and remember the 34 symptoms. Additionally, we can always, it's different from person to person. We cannot say 34 symptoms will happen to everybody. So, if everybody starts to call their own symptoms, it might be different from person to person. So, and it's so difficult for us to get a clear-cut position to say, this one are menopause cause, this one are age cause, this one are menopause. So, we all here, we learn from ourselves, and by God's grace, we'll continue to act and do accordingly. Sisters Wadu.
Okay. Just to add to the hair loss, so if we want to talk about menopause, think about what your body, so you see girls, you know that
they've reached menarche because their skin starts glowing. Their skin is really smooth, really, And when you reach menopause, you see that your skin, the suppleness, the glowness is all gone. It's part of the hair, there's no estrogen. So that's not a problem. That's just so what we're focusing on is what that will take you to the hospital, what you need to do about it.
Okay, thank you.
HRT, it is not something you completely rule out. There are many testimonies about the HRT. You don't try it, you don't know. There's no need for you to suffer if you can try it. What works for A may not work for B. But there are many testimonies of people that they don't even remove it from my repeat. Don't even try it. Because if you remove it, I'm a mad woman. Everybody's different. Please.
Yeah, thank you.
Thrush, and wanted us to talk or give a bit of education around thrush. For me, I think it's something that, other than thrush, there are many more topics we can even go on to talk about. So, thrush is a fungal infection. Based on the fact that it's a fungal infection, let us not see it as this person clean, this person dirty. Sometimes it's your own body makeup. So if you find that you suffer with recurrent thrush, it's important to check yourself. Am I wearing the correct underwears? Some people are used to nylon. It depends on the material. So check it. Some conditions, fungal infection thrives more on a certain environment. So if you find out that you suffer with recurrent thrush, it might be helpful to check what am I wearing, what am I eating, what am I doing, and see how you can change. Again, lifestyle changes, it's important. When you check all this and you find out that it's still there, seek help. You can see your GP and let your GP prescribe some topical antifungal treatments. If you try it, it's still not okay, then you can prescribe something that you can take systematically, we call it, into your system, and then have a treatment as well. That's just a nutshell about it. I don't know if Sisters Salome will want to add or anybody else. However, there was something I thought I should just also add as women here. Some of us might be saying we're not too old, but something I think is very helpful for us as women is pelvic floor exercise. Pelvic floor exercise is so important. We don't want to be like some people that are wearing diapers at old age. Okay. If you start now to start doing your pelvic floor exercises, it will help you even in your bedroom activities. Pelvic floor exercises are so good. I don't know, Sister Rachel, you were going to say something.
How do we get access? Yeah, how do we get access to pelvic floor exercise?
Yeah, how do you have access?
Yeah, although how can we learn more about it?
With pelvic floor exercise, what you could do is you would pretend you need to go to the toilet.
Okay.
Hold on to the pelvic floor. Like the toilet is not there and you need the bathroom to wee. You hold on to your pelvic floor, hold like you want to hold your urine, and count for probably 10 seconds and let go. And you do it regularly. Let it be part of your routine. Every time you sit down, you're doing your pelvic floor exercise. That is a way to do a pelvic floor exercise. And also lifting things, or you're bending, you automatically clench as if you're going to wee. You clench because putting pressure on the pelvis, on the pelvic floor, that's what makes it give way. So anything you're lifting, you're bending, you're squatting, you clench.
Okay, thank you.
And another thing that makes it worse is childbirth.
Okay.
So, yes, and with the thrush, that is. So if older women have those symptoms, you need to see your doctor. You need to have a possible swab, or you need to check that there's not something else going gynecologically. Because if you go to the counter, at that age, they won't sell any thrush medicine to you. So you have to go to your doctor to have it checked.
Okay. Thank you for the information.
I just want to talk a little bit about my own younger experience when I was having this thrush when I was younger. when I saw the doctor, he said, you blacks, you wash too much. You will dig and you wash, you use Dettol. You clean the healthy thing that bacteria that helps you to fight this trash thing. It was then I stopped digging and washing the Dettol and all that.
Yeah.
And my trash went. And my trash went. You just use just ordinary water, not soap. Because you clean away the good bacteria, and what happens? Nothing to fight.
Yeah.
That's my own experience when I was young.
So the ordinary water will remove all.
Can we round up?
I want to thank Sister Ebi and Sister
Can I just say something on the trust? Just last one, yeah, about trust.
Another time we do trust talk.
Yeah. I want No, it's not a big thing, it's just something small. What I wanted to say is, my sister was going through that when she was pregnant, and they said it's due to because she's diabetic type 2. That's what I wanted to say.
Health conditions too.
Thank you, ma. Thank you, Sister Salome. Thank you, Sister Ebi. Please let me have a round of applause.
Hello viewers, standing before us is Sister Salome Ojakovo, one of the women of God's Kingdom Society, United Kingdom branch, a medical practitioner that has just finished talking to us about menopause as it affects all women certain times in their life. Sister Salome, what the last advice can you give to any woman going through menopause at this moment?
So the last advice, the takeaway will be that menopause is a natural event. There is no, women should be transparent about it, because being transparent about it, if you are one of those that are not suffering for it, suffering from the symptoms, or you have ideas of how the symptoms you suffer from, how you address them, you can share it with others. And if you talk about it, because you are suffering from symptoms, then you can have help from people that are knowledgeable about it. So it's a natural event in a woman's life. It's something that we women should wear as a pride, because it's part of our physiology, and that it's not to be ashamed of. If we need help, we ask for help.
If you need help, ask for help. It's part of our physiology or psychology? Physiology. Natural physiology. So as women, we should be proud of menopause.
Yeah.
And just one last thing. How have you seen the event today? Oh, it's an inaugural one.
Yes, no, it's been wonderful. It's been well organized. As anything that is inaugural, there are learnings that will take away to make the next one better. It's great. I wish that more sisters are here, and I'm sure when they see this next time they will come, because it's been really lovely.
Definitely, it's been really lovely. Thank you so much, my dear sister.
Thank you, Sister Adete.
Thank you. Bye.